day, viewers. Welcome to NOA River State Dialogue. This is a weekly sensitization program of the National Orientation Agency River State, supported by UNICEF. Our topic for discussion this Friday is drug abuse among children and youth in our society. Now, drug abuse is a global health and social problem with distinct conditions and problems. The use of psychoactive substances amongst adolescents and youths has become a subject of public concern worldwide due to the fact that it contributes potentially to intentional and unintentional crime like kidnapping, rape, cultism, robbery, banditry, and so much more. And despite the efforts of government and NDLEA in particular, we have seen an increase in the cases of drug abuse, especially amongst our adolescents. With me in the studio this morning is the Public Relations Officer, NDLEA River State Command, and his name is Mr. Emmanuel Ogbungbada. You are welcome, sir.
Thank you, and good morning to viewers.
Good morning. He's a friend of the agency, and we're excited to have him here this morning.
Thank you.
Now, I'd like to kickstart this whole process. What is psychoactive substances?
Well, psychoactive substances are those substances that have impact on the central nervous system.
Okay.
Yes, they have direct impact on the central nervous system. So they are actually drugs,
okay,
or let's call them chemicals.
Okay.
Because whatever drugs you take are of course chemicals, and when they go into the body, they have direct effect on the central nervous system.
Okay.
So which acts to activate the central nervous system to either make it work faster or reduce, the work rate.
Okay.
So they have various. They could be, they could hallucinate. They could cause hallucination,
okay,
and so on and so forth.
Okay.
So these are psychoactive. Those ones that directly have impact on the central nervous system.
Okay.
Yes.
Okay. So, but why do people use these drugs? Why do people use them?
Well, a lot of reasons could be attributed to the use of drugs.
Okay.
But first, let us identify what exactly is drugs.
Okay.
A lot of people will say, is it not drugs? Because some
is there a difference?
Medicines,
is there a difference between the psychoactive substances and drugs?
Yes.
Okay.
Yes. There are drugs you take that may not have direct impact on the central nervous system.
Okay.
These are drugs like maybe if you, for instance, you have a pain on your arm and you take those drugs, they want to, they go straight and take it. But psychoactive drugs, directly, impact on the central nervous system such that the impact of that drug will, have overwhelming influence on the person.
Oh, okay.
And then will probably affect the mood, the behavior, and almost everything about the person.
Okay.
Yes.
So why do they abuse these drugs? Why do people use these drugs?
Like I said, a lot of reasons. Some people, like the youths of these days, they want to get high. The so-called high, they want to get high. Maybe because they lack confidence, and then they want to take it, and when they take these drugs, it removes every form of shyness or stage fright, and then it gives them that highness. It makes them see you as a nobody, that you are just a small child, or even they no longer see you as somebody that they should fear.
Okay.
Yes.
Okay. So why do they abuse it?
A lot of reasons. First, ignorance.
Okay.
Yes, ignorance, I would say, is the number one culprit.
Okay.
It's just like there is fire burning. I once was some 13 years ago, a little boy, a neighbor's child.
Okay.
At that time, there was a candle lit, and then the little boy was trying to catch the fire. You know, a boy of about a year and a few months. He was eager to catch the fire. I was trying to stop him. He was stretching his hand to catch the fire. So by the time my attention was diverted, he put his hand and the fire burnt his hand. Okay. And then he no longer wanted to touch the fire. Each time, and I said, hey, touch it down. You say no. You know, so the boy at that initial time was ignorant of what fire could do.
Yes.
So by the time he put his hand there and felt that pain, he now realized that this is a no-go area.
Yeah.
So a lot of youths go into drug abuse as a result of ignorance.
Okay.
Now, aside from ignorance, curiosity.
Okay.
You see that little child that I told you was curious, wanted to know what is this thing looking red and glowing. So he was curious. So curiosity is another thing.
Okay.
At that age, they're always curious, they want to experiment, they want to know more. And then peer pressure.
Okay.
Yes. When they want to feel among, you know, the children they want to get along with others. Perhaps they've seen what maybe attracts them in those group or those other friends, and then those ones give them condition. If you want to do like me, you have to do what I do.
Yeah.
Or even if they don't give them condition, the moment they begin to flow and they see what those ones do, you know, they want to also get involved. But above all, parental upbringing is another issue.
Okay. Yeah. How?
At home, you know, the home is the first port of call for a child.
Yes.
Now, it is said that if you train up a child in the way he should go, when the child grows up, he will not depart from it.
Okay.
Now, if he has to depart from it, it means that some of these other influences have come to play.
Okay.
And even at that, at some point, the person may realize this on herself and come back.
Okay.
But when you have a home where the parents are always at loggerhead fighting, the child now is at liberty to take decision or bring his or herself up the way he wants to. Some other external persons could also influence the growth of the child, the development of the child. Now, if you have drug abusing parents, of course they are role models to the children. So the children will take after, this is what my father does. And then he will have
there's nothing wrong with it. Yeah, my father can take it, then
exactly.
What's wrong?
You know, so the parents should be very careful with what they do, with what they let their children see, because it has influence on them. I remember once when I was growing up, I was about 8, 9 years. And I was curious. A neighbor was always sending me to go and buy cigarettes, you know. And I was curious. I said, because the way he puts his hand to smoke it, it's as if, oh man,
it's in another world.
It's so sweet. And then that curiosity led me into, you know, when he sent me to buy two, I bought two, I hid one, and then brought back one to him. You see, it has led me, that curiosity has led me into telling lies. I now gave him one, I said I lost it on the way. He scolded me and then forgot about it. And so in the night, I went to our toilet. Then it was in the village, this detached toilet arrangement. I went there, lit the thing, and I smoked and started coughing. You know, fortunately for me, my elder sister was also going to use the toilet at that time. So when she came to the toilet, it was difficult for me to open because the smoke was all over. So eventually I opened the door and she passed and said, this is what you are doing. Daddy must hear this. I started begging her. I had to mortgage my meat for like 2 weeks. And then I took her turn to wash plates. You know, and I never went back to it. You know, so now if my sister
had not come
to, you know, but the influence of my family, mere hearing that mommy and daddy will hear this, you know, it was a very big issue for me because I didn't want them to get to hear. You know, that is one. Secondly, if the home was a careless home where everybody does what he likes, my sister will not care. She will not care. She will not threaten me with reporting to my parents. And then, of course, I will go ahead and continue. So what I'm saying, the essence of bringing in my own experience is to let people know that the family is very, very important. If the brothers and the sisters and the family and the parents do the right thing and impart the right training on the children. You discover that even when one child is trying to go astray, the other one will help to bring the child back. And that was exactly what happened to me. I was, of course, every child curiosity
want to try something. So now, who is to blame actually for these rising cases of drug abuse among our children and youth? Who is to blame? You're talking about the family angle. You're taking it from family. So, is there the family also, has to be blamed for that?
Yes.
You understand?
Now, who are the major people that have role to play in the development of the child? The family is there. The community at large. Now, for the community at the community level, what are they supposed to do? Everybody is supposed to look after themselves according to our African, culture, African way of life. But these days, you discover that a child from your neighbor's house will be misbehaving. You say, leave that child. If you scold him now, his father will come fighting you.
Exactly. So changing our value system also.
Changing our value system. So we used to know when we were growing up that a child is a child of everybody.
Yes.
So if you are misbehaving and you see an elderly person, you put yourself back together.
Yeah, exactly.
But now the children just go all out and do
people are even afraid to scold other people's
children.
Exactly.
Some when a child is flogged at school, the parents will go fighting the teachers and all that. So some parents don't even scold their children, don't even flog their children when they go wrong. You flog with love.
Yes. You flog and then you tell them the reason why you are flogging that child.
So the family has so much blame. The community. You see in some communities, you see some heads, some community heads, some village heads, arming boys. Arming boys, encouraging them to go out
and people take these drugs so that they will feel high.
Exactly. And then the politicians. The politicians who use these boys for their political errands, their negative political errands. By the time you arm them, you give them drugs, they do all manner of things, you win election, you can't continue to arm them and give them drugs. You abandon them, and then these boys will they have already received initial
training. They look for other ways to get
they must sustain that habit.
We're going to come to that aspect in terms of the stakeholders. But I want to find out what's the difference between drug abuse and drug misuse?
Well, there is a
because some people will say, I'm not abusing it now, I'm not abusing the drug, and all that. What's the difference?
There's a thin line between drug abuse and drug misuse. Somebody who misuse drugs and then get to a certain extent, it turns to drug abuse. Yes. Now, for drug misuse, if for instance, there is doctor's prescription, and the prescription says, take 2 in the morning, 2 in the afternoon, or 2 in the morning, 2 in the evening. And then the person goes ahead to take 3 in the morning, 1 in the evening. You have taken 4, but you misused it. That's not how it's supposed to be. Yes, it's drug misuse. Now, if after that, within that prescription period, you now go ahead to buy that same drugs on your own to start taking, you have started abusing drugs. So there are 3 basic elements that make up drug abuse. Using drugs that is not prescribed. Taking drugs for non-medical reasons. Some people take drugs for recreation. You see somebody go to buy tramadol. He does not have pain. Tramadol basically is to kill pains for accident victims or women in labor and all that, those severe pains. And somebody is not having any kind of pain in any way, but he goes to buy drugs just to make him feel high. That is for recreation. It's drug abuse. And then the third factor is when you use drugs that is prohibited, like cocaine, heroin, cannabis, and all those drugs. The moment the law says it is prohibited, you cannot use them. If you use them, it's drug abuse. So these are the 3 elements of drug abuse.
So what are some of the effects these drugs have on our children and youth?
Quite a lot. Now, if we divide them into 3, 3 basic effects, we have the physical, which is health, the social, and the psychological. Now, for the physical, it's basically health problem. You see some of the vital body organs begin to deteriorate. Yes, they deteriorate. You see the kidney especially suffers. Because when you begin to take in things at the wrong time, when they are not supposed to get into the body system, you overlabor the kidney.
Okay.
And then before you know it, it packs up. The liver also, the lungs, for those who smoke
it, okay.
You know how much you're taking in, these carbon dioxide and the tar, all those substances. It begins to affect the lungs.
Okay.
And then, and then even the blood is affected because you are contaminating the blood with all these things you take into the system. So a whole lot of things happen to the individual. So, and then for the social aspect, when people are under the influence of drugs, a whole lot of things could happen. Drivers who are under the influence of drugs get involved in accidents easily. For company workers, those who work in factories and all that, you see a lot of them sustain industrial injuries when they are under the influence. Now, how about kidnapping, robbery, cultism? When people are under the influence of drug, they have to do these things. You can imagine just in the recent past where cult war, you see somebody's family, somebody, cult group members will go to look for somebody, maybe one of their opponents.
Yes.
They go there and the person is not found. Then they will say, make we drop message. They will just shoot somebody. An innocent person, shoot somebody. That is a way of dropping message. It's insane. It's insane. So a lot of things go wrong. And then for children dropping out of school, since we are basically looking at children dropping out of school. And let me even say it, that now drug abuse has gone down to that level of primary school.
Wow.
Yes, there was an incident that happened. A child was sent on an errand, and then when he bought, what they sent him to buy, and then he dipped his hand in the pocket to bring out the balance, and then tramadol fell off his pocket.
Wow.
A child of 8 years old. How did he get this? Say, then they give us when they carry play ball now.
My God.
So these dealers are eager to initiate more people into the deadly habit, so that they will find markets.
We're going to come talk more on that. Viewers, I think you can start sending in your comments, questions, and suggestions. I'd like to take some of it before we go on to other aspects. From Mr. Abie, he says, NOA River State, you are indeed consistent to time. Keep it up. We are proud of you. Thank you, Mr. Senibo. And he also is asking another question. I think you have answered it. He said, I want to know if drug and substance abuse is related to mental illness.
Yes.
Yeah, he mentioned it's one of the effects.
It's one of the effects. The psychological aspect of it. I mentioned.
Is that why we have a lot of mad people?
Yes. I mentioned physical, social, and then the psychological. A lot of madness, a lot of psychosis, paranoia. You see some people. You see somebody that is a very calm person, and suddenly he becomes aggressive. Or you see somebody that is all outgoing, freely sociable, and suddenly he's withdrawn. So the effect of drugs psychologically depends on the person's body makeup and the type of drug used as well.
There's a question that is coming to my heart about, you mentioned something now when you see somebody that is withdrawn, somebody that used to be outspoken and then suddenly is withdrawn, or somebody that is withdrawn suddenly becomes. I want you to talk about that, but let me just take some of the comments. And how the role of parents in curbing this. So he's also saying drugs are used to cure diseases and sicknesses. So at what point can we say that same drug, which is used to cure sicknesses, is abused? At what point?
Okay, that's what I did.
You talked about it.
Like somebody that is on prescription.
Yes.
And then when you go beyond after the prescription period, you now begin to on your own to buy these drugs and take. It becomes drug.
We have from Mr. Bekimbo Williams. He says drug abuse are multifactorial, behavioral, emotional, environmental factors that place children at risk for the development of substance abuse. May it be remediated through prevention and intervention program, research-based comprehensive cultural, social resistance skill training, normative education in active school-based. Well, he's suggesting ways in which we can curb this. We have from Mrs. Abehat. She says, lack of parental care and being abandoned can also influence our children. Our parents should only have the number of children they can manage to be a proud parent. You don't just have them. You know, coming to that also, well, let me take one more point, because you have a lot of these teenagers, adolescents, you see them on the streets, in the name of they are helping to clean your windscreen, and you notice how they get involved in things like this, you know. So we're going to talk about it. We also have from Mr. B saying, what are the effects of drug abuse into the society? You know, you have mentioned a bit of that. From Mr. Ellis Dapper, he said, is there any nexus between drugs and crime in our society? So please, let me just take as much as I can take for now, so that when you answer these questions, you'll be able to touch on it. Then Mr. Chinwe Okwara said, disorientation, anxiety, and poor performance in school are some of the negative impact of drug abuse on our youth. You know, there's really need for government to fight against drug abuse through proper funding. It's relevant agencies like NDLEA and other security agencies, you know, suggesting ways in which you can curb this. Then Mrs. Abehat again says the government lacked the strong will to enforce the laws made by them to block the access to these hard drugs because of corruption in our society. You have heard a lot of the comments. What do you have to say?
Yeah, they've all said the right thing.
Yeah.
They've all said the right thing.
Yeah.
You see, like, you know, parents, some parents push their children into drug abuse. Yes, erroneously or unknowingly.
Yeah, because the children want to please the parents, right? Okay.
Some parents want their children to be like them.
Okay.
Like, you know, every child has his or her own calling.
Yeah.
Now, a medical doctor parent want that child to, I want you to be like me, a medical doctor. Maybe that child wants to be a musician or something.
Yeah.
You know, and then you start forcing the child, and then in school, and he's not able to meet up with those subjects that will lead him into going to that course.
Okay.
You want to do something, and if they tell him that, look, there are drugs you can take to help you, like Indian hemp, cannabis sativa, marijuana. A lot of people will say, some people will say, that thing they help. If you take it, you open up your brain. Wow. In fact, one of the street names is wisdom weed, or wisdom leaf. Wisdom leaf. Okay. Because of the hallucinative nature.
Okay.
When you take it, you begin to see things, hear things. In fact, sometimes somebody told me that whenever he takes it, he can hear the voice of somebody that is about 100 meters away.
Is it really true?
That's what he said. So you see a lot of hallucination coming into place.
Okay.
You know, so now they believe that when they take these drugs, it will open up their brain and make them read well.
Okay.
Some will say they need to take tramadol or diazepam to keep them awake so that they will read longer time and all that. So when parents push their children so much, they will fall into the hands of the wrong ones and then get involved in drug abuse. Okay. Now the issue of whether there is a nexus between drug abuse
and crime.
Definitely.
Okay.
It's very, very obvious. Yeah. I said earlier, cultism and all that. I remember in 2014, early 2015, prior to the general election, the military embarked on mopping up, arms in the society. So they went into all those gray areas to search for, and mop up. Now the report was that for everywhere they found arms, they also found drugs.
Really? So?
Yes, they found drugs.
Drugs, yeah.
So you see, now we got reports that Boko Haram, and all these kidnappers, especially the Boko Haram people and those people, when they demand for ransom, if for instance they say bring 10 million, they will say take 1/3 and buy tramadol. Out of the 10 million, use 1/3 to buy tramadol.
Really?
Yes. So when they are paying ransom, they pay with money and drugs. So you see how
the connection between that. Yes. So let me ask, our time is actually running on. but we might need to extend just a bit. We'll talk about the role of the parents here as a stakeholder in this matter, you know. So what like, for example,
in fact, we are all
stakeholders in it, yes.
The individual himself is a stakeholder.
Okay, good, yes.
The individual is
how is he going to,
yes.
What efforts?
Yes, because as an individual, you know, you need to refrain yourself from getting involved in something that will destroy you. Self-preservation should be number one.
Okay.
You know, self-preservation. Now, drug problem, sometimes it does not really spring up just like that.
Okay.
You know, drug abuse or drug dependence, addiction dependence results from consistent use, consistent abuse of drugs.
Okay.
We always say, don't try.
That's the word. Don't try it. Yes.
Because if you try it, it will the reward system in the brain may activate, you know, that perception, so that when you see people doing it, your brain will remind you that, look, this is how you felt at that time. Go back to it. So we say, for the sake of your health and the society, don't try it. But you discover that sometimes when people try it once, you know, at that point they have not become addicted yet. Even though some people could, you know, go gaga when they try it
for the first time.
Some may even develop, you know, brain problems. They may go mad at one try. But most of the times it does not work that way. The only thing it does is that it will just create that reward system. You know, but if you are able to hold yourself back, you refrain from going further.
What about somebody that is already deep in it?
Yes.
What is there help?
There is help. There is intervention.
Like you said, as a stakeholder, you are a stakeholder.
You are a stakeholder.
In it. So let's say you've talked about if you are trying
let me finish other stakeholders and I'll come to help. Now, the family, I said earlier, the family. Parents have to be very, very careful.
And be vigilant also.
Be vigilant. For about 3 years running, 2018, 2019, and 2017, 18, and 19. United Nations International Day Against Drug Abuse and Illicit Trafficking celebrated every June 26th. You know, the theme for that celebration for those 3 years was listening first. It's a call on parents to listen to their children. Well, children, some parents, I'm so tired, go and meet your mommy, go and meet your daddy. And then they will not listen to that child. That child wanted to tell you what the experience he had in school.
Maybe somebody had just introduced him to drugs.
So if you listen to your child at that time, you'll be able to save that child. But if you don't and you send the child away, he goes away and it's okay. Those people are better than my parents.
They can listen to me.
So the parents have a lot of work to do. Now the community itself should organize themselves. You know, before, when somebody is doing the wrong thing, everybody knows that this is the black sheep of the community. But now, a lot of people do it and they say, I'm not leaving. You know, and then parents also live in denial. Somebody comes to tell you, look, I saw your child. It's not my portion.
My child can never do that.
My child can never do that until the child
becomes too late.
You know, and then the government. Somebody mentioned the government. Yes, the government have to have that willpower. You know, to continue to support the agency that they have set up to curb these things. Now, if NDLA has enough tools and facilities to work, we will be able to curb this. And I'm sure our new chairman, chief executive, retired Brigadier General Abuba Marwa, has said a lot about how he's going to make sure that the agency is highly empowered, and we believe him. And so we're fired up. He has asked us to go on the offensive action. Yes. You know, before now, like drug dealers who are the ones spoiling the people, the users are basically regarded as patients. They are sick people because they are users. They are victims.
A
lot of them due to ignorance. So you cannot really blame them that much. They are victims. So the dealers are the criminals because they sell these things and fly to the bank.
Exactly.
You know, so those are the people who go all out to arrest. The victims will rehabilitate them. You know, so now if you go on the offensive action and then circulation, you see the incidence of drug abuse will reduce. So,
let me take a comment. It says it's rather unfortunate that most of the personnel of agencies saddled with the responsibility to enforce the abstinence of and confiscation of the drugs don't have the moral justification, as they also use the drugs.
No, that's
and these persons have children who see them use it. They also send them to buy these drugs also.
No, that allegation is unfounded.
Okay.
Yes, I cannot speak for everybody that works in any law enforcement organization, because I know complaints have come. We have even arrested some law enforcement personnel.
Oh, really? Because we see a lot of them on the road, and the way they behave, you ask yourself.
Yes, we have actually arrested some. But the good thing is that every security agency has a system put in place that checkmates these people.
Okay.
Yes.
Okay.
So sometimes the military will bring their own personnel who were found indulging in these things to us to prosecute.
Okay.
You know.
Okay,
so every system have their own way of dealing with this.
Okay.
So nobody is exempt. Nobody is above the law, whether you're a law enforcement personnel or not. So the issue of saying moral justification for law enforcement to do what they know is out of it.
Okay.
You know,
so what effort has your agency?
Okay. Before I go there, let me. Okay.
Yeah, but you were to answer his question.
Intervention.
Yes. Okay.
There is hope for the drug users.
Okay.
Drug abusers. There is hope for them.
Yeah.
You know, part of the efforts the agency puts in place to ensure that these people are brought out is rehabilitation.
Okay.
We have a rehabilitation facility.
Yes. Okay.
Yes, though it's not a big one.
Okay.
It's small, but the governor.
You have it in your office here in Rivers State?
Yes, we have it in Rivers State. And the governor has also promised
to
join hands with us to ensure that he gets us a big one.
Okay.
You know, that will accommodate male and female.
Okay.
A lot of female come crying.
Really?
Yes. So we managed to keep them in our sick bay, you know, but that sick bay can only contain 2 or 3 people.
Okay.
You know, so you know that's part of what we do. We counsel people, we rehabilitate people that are addicted, you know, and release them back to their families after they have completed their treatment. You know, now we must do this. This is drug demand reduction.
Okay.
Counseling and rehabilitation is to ensure that the demand for drugs go down.
Okay.
But we must do it simultaneously with drug supply suppression. So the supply suppression aspect of it is the distribution of these drugs to users.
Okay.
You know, so side by side, while we have our operatives go on the offensive to arrest these people, seize the drugs, destroy the drugs, and then send those people to jail.
Okay.
This other unit is busy reducing demand for it. So by so doing, it will come down. But everybody's hands need to be on deck. You see some people, they see people smoking, say, where is NDLA that they cannot arrest these people?
Yes, we have things like that.
You owe it as a responsibility to find NDLA and say, there are people doing this here. We're not spirits, we can't be everywhere.
Okay.
So wherever we have not been able to reach, and it's happening in your neighborhood, you as an individual that is not abusing drugs, you owe it as a responsibility to notify NDLA. I assure you that we maintain confidentiality. We don't expose those who give us information.
Because some people are scared.
That's the fear.
Yeah, some people are scared.
That's the fear. But nobody, if there is any complaint where I say, look, I gave NDLA information and my identity was revealed to these people, just let us know. And we'll handle it. We have a very strong system that takes care of those who go contrary to these laws.
Okay. There's a comment here, and it's interesting. But from Mr. Seniboy, it says, is it true that some persons take drugs to enhance sexual performance?
Very true. Very, very true. In fact, a man that was brought to our facility for rehabilitation. Now he was on tramadol. Now when he was interviewed, we now discovered that it was actually his wife that introduced him to it. That she was complaining that he wasn't performing enough, and so she introduced him into tramadol in order to help enhance his performance. And then in the process, he started abusing drugs, and then he began to misbehave. And so she now.
But she was not taking the drugs.
No, she wasn't. She wasn't. She heard from friends that tramadol enhanced performance. So she made it available for her husband. And then he got involved and started abusing drugs. And so she now had to come looking for help again to bring the man back. So
does he eventually help? Did he come out of it, or is still in the process?
No, that was a long time
ago. Long time ago.
He came out of it.
Okay.
Yeah, he came out of it.
So
our rehabilitation facility is designed to help people. And then there are other private rehabilitation facilities as well.
Okay, in River State?
Yes, in River State.
Okay.
And there are also, like, Teaching Hospital has a rehab facility there.
Okay.
University of Port Harcourt Teaching Hospital has. Redeemed Christian Church of God also have their rehab center.
Oh, really?
Yes,
Okay.
they have.
Okay.
And then we also have.
So before, at the end of this program, you are going to help us with some helplines.
Okay.
Which our viewers can call if you know somebody that is into abusing drugs and all that. You can call, those numbers, and then they don't have to come physically to your office.
No,
you should have dedicated.
I can give the phone number of the personnel in charge of rehabilitation center. And then I can also give my own phone number.
Okay.
Okay.
So they can call. Then lastly, let me ask one last question. We're talking about children here and youth, and you have also in the discussion you have said that it has even come down to the children in the primary school.
Yes.
What is the way forward? Because we are here to seek solution to these rising cases. So what is this? What is it? What is the way forward right now? Because we need to help these children.
The way forward is collective action.
Okay.
Collective action. We, as NDLA officers, were prepared to do our job by going after those who are distributing these things, and then sensitizing the public, sensitizing the public, and rehabilitating those who are dependent on drugs. But above all, let everybody join hands. Give us information, we'll act on it. If you see somebody that is going astray, you find a way to report. Parents should look after their children. Look after their children. Very, very important. The community, the leaders, community leaders, youth organizations. In fact, we have drug-free clubs at secondary, primary, secondary, even tertiary levels, and then community level.
When did you start that?
It's been on.
Oh, it's been on.
Yes. So it's just for the people to come together and agree that look, they want to form drug-free club. They notify us. We give them the constitution and teach them how to go about it. Just 2 weeks after the Honorable Chairman, Chief Executive of NDLA visited River State, he called stakeholders like the Muslim community, the Christian community, road transport workers. Just 2 weeks after he left, the Muslim community set up a drug-free sensitization committee.
Good to hear that.
They set up a drug-free sensitization committee. And then we went there, we inaugurated the committee, gave them the constitution, tell them what to do, give them some materials, how to go about it. Anytime they have any program, they should call us. And they promise that in the mosque, they will be preaching in the mosque, sensitizing people about the dangers of drug abuse. So that is a very good thing to do. So if we all form groups, that will help to sensitize, you have even done half of our job.
And also taking responsibility as parents, like
exactly.
you said. So one last word for our people. I know our time is running out. One last word, and then give us the helplines that they can call.
Okay, my advice to our people is that everybody should join hands.
In this fight, honestly.
To fight this fight. You see, the problem with this fight is that it's not a conventional war where you are seeing your enemy, you shoot, he's dead and gone.
Because you have some quiet ones that abuse these drugs
and
they
can eat up into your family, and before you realize it, you discover that everybody is every young one in the family, and when the young ones are into drug abuse, what kind of adults will they become? So what kind of leadership will they give us in future? So everybody needs to join hands. Everybody, whatever you can do. If you don't have anything, if you don't know much, seek information. Seek information.
So viewers, we are almost coming to the end of this program, and I want to thank you, Mr. Emmanuel Ogungbada, and I would love to have those helplines. While I just take a comment from Mrs. Baligo, she says, please, I want to ask, is it true that NDLA Rehabilitation Center is very expensive? Charges from 150,000 upwards.
Well, I wouldn't say very expensive. When expensive is relative.
Okay.
It's relative because first, when somebody is admitted into a facility, before you are even admitted, they have to run tests.
Okay.
They have to know the type of drugs the person is abusing.
Okay.
Yes.
Okay.
And then the extent for how long. And then they have to run tests to know whether the person has other ailments, like HIV, diabetes, you know, and all that. Hepatitis B and C. They run all those tests.
Okay.
So who pays for it? The government does not pay.
Okay.
So who pays for it? And then the person has to be fed. Who pays for the person's feeding? It's the family.
Yeah.
You know, much as we sympathize with the families, but I think the money you spend will be justified.
Okay.
Yes.
What about those that, you know, on the street, somebody calls and says this person has been abusing drugs and all that, and the parents are not even around, you know, to help out in the payment? Will that person be abandoned?
No, we have some small intervention packages
for
those people.
Okay.
You know, we start by counseling them, and then as long as the person has identified that he has a problem and is willing, it's even the number one step.
Okay.
You know?
Okay. So let's take the helplines.
Okay. For my line 080 62 56 3677.
Okay, take it again for Mr. Ogungbada.
080 62 56 3677.
Okay.
And then for the drug demand reduction unit, the counselor, the chief counselor there, Mrs. Stella Maris, 080 33 19 1414.
Okay, take it again.
080 33 19 1414.
Okay. So thank you so much, Mr. Emmanuel. It has been, I wish we could continue. You know, but time is of essence here. There's a lot to talk about. But we'll bring you again if you will honor our invitation. So viewers, you know, we really can't exhaust this topic today. You know, but from all we have talked about, the onus lies with, from what we have talked about, the parent, the home. The home.
Starting point.
You know, we talked about that last week. That is the starting point. So we as parents have an important role to play. And I like the part that Mr. Ogungbada said, that was telling me came up with the top. I said, parents, listen to your children. We need to be observant. We need to listen to our children. You need to find out the kind of friends your children keep, the places they go to.
Yeah.
You know, so it will take the parents, it will take the community, our government, the political circle. Each and every one has a role to play. Don't just abandon that child. Don't kill that dream. Your children are your dream. Don't kill that dream. Don't abandon that child. And I know that NOA, in all our offices in the local government areas, we go to schools to sensitize these children on different topics. And this drug abuse is one of them. So thank you this morning, viewers, for streaming live with us. One last word from Mr.
Yes, let me use this opportunity to once more thank NOA for what they are doing. They have been very, very consistent in taking us along. Wherever they have programs, they remember that, look, people need to be sensitized on the dangers of drug abuse.
Exactly.
They invite us, and we are very happy to associate with NOA.
We are excited to we are happy to partner with you anytime. So thank you, viewers. It has been a great day and a great topic. And thank you, Mr. Emmanuel Ogunga. Thank you to NDLEA River State for releasing Mr. Emmanuel to talk with us this morning. Stream live with us again next week, Friday, for another important topic. Remember that you can catch up on our previous topics by going to YouTube, search for NOA River State, and don't forget to subscribe. This program is the program of the National Orientation Agency, River State, and it is supported by UNICEF.